All right, so we are back. I just talked about my last video about different, some simple epidemiological models for tracking the spread of a disease through a population, or modeling it through the spread of a disease through a population, such as COVID-19, and talked about some specific parameters and the way of framing risk assessment and how risk impacts public health risks. And so now what I want to talk about is a segue into impacts of public health policies on that risk and how the disease spreads. So I want to go back to this table for a second and just remind you that what we found is that, with the model that I developed, working with probability, the number of interactions that a family unit will have, or a pod of people will have with the general public, directly impacts the risk to themselves. And is dependent on the number of interactions, how risky those interactions are, and also how many cases are active in the public, how many contagious people, individuals, and what portion of the population is contagious. So that can certainly help inform about acute risk scenarios of acute risk that pod wants to undertake. But also, just as importantly, and if not more importantly, there's the impact on the general public, which is not dependent on the current number of cases. So even if cases are low, there's still a certain amount of risk. The risk that a group of individuals will impose on the rest of the public matters, because cumulatively what can happen is the replication number, which is dependent on social behaviors and social patterns and patterns of interaction, can exceed 1, in which case you go back to having logistic growth and really high numbers of cases, even if they start low. And we know this can happen even within a few weeks. You can have, or within a couple months, cases can really grow into a real problem. And those are cases that would otherwise have been ignored if more precautions were taken and more policies were in place and more behavioral shifts. People, shifted their behaviors more to prevent those cases. And there's a variety of impacts. But we talked about that, right? Because if you don't take any interaction, no interventions, you see a curve that looks like this, where after around 71 days, you're seeing a maximum number of infections, even somewhere around here, you're starting to see infection rates that are just really difficult for healthcare systems to deal with. And we also know that the impacts and how the replication number is affected by social shifts and social behaviors can affect whether or not a lot of people are ultimately exposed or very few people are ultimately exposed. There are health policies that are put in place to help facilitate those behavioral shifts and help guide people in safe behaviors. And so I want to talk about what some of those are and what some of the goals are of those. So on the left-hand side here, we have policies or habits, and then the impact, both the indirect and direct impact that policy is intended to have and can have if it's followed, adopted widely. So on, staying home as much as possible. The point of this, so numbers 1 through 6 have kind of clustered together because they are all about lowering the number of interactions, right? So if you go back to the mathematics here, right, the expected number of others infected in equation number 10 is dependent on the risk of transmission as well as the duration in the population, but also the number of interactions. So the duration of that a contagious individual is active in the public and the number of interactions. So remember, many people do not know that they are infectious, which again, not to confuse, right? Many people don't know that they're infectious, but a lot of people that do get sick are severely sick. It's not to say you should ignore it. I'm just saying that many people, it's not a real big issue. For them individually, but for a society, it is a significant problem, potentially, right? And I do want to talk about that in another video about how to interpret risk and how you can frame risk in terms of normative statements and normative actions. But for now, I'm just saying that the whole point of 1 through 6 is to lower the number of interactions so that the R0 stays low. Because if you lower the number of interactions, as I showed in this table, if you keep this number low, then your R0 goes low, and then you don't have logistic growth, and it just has either linear growth or it just dampens out critically, very, very few cases. So staying home as much as possible. talking on the phone instead of meeting up in person, avoiding public transportation as much as possible, limiting travel to go visit someone, or just interacting with the public in general while you're traveling. This means, this is why people are trying to work from home, and certainly skipping social gatherings, crowded bars, sporting events, etc. In many cases, those are just not allowed by the government orders in Massachusetts right now. But certainly that is the intended effect, because especially in those cases, those large crowded areas produce plenty of opportunities and plenty of interactions, in some cases close interactions, especially in closed spaces, for transmission. And what the result is that R naught would go up. So if you limit these interactions, or you say certain interactions aren't allowed, this lowers the R naught, and this keeps cases way lower, and you're saving hundreds of thousands of lives by doing that. It might be a pain, but if it's feasible to do, it certainly makes a difference in saving a lot of people's lives. Those 7 through 13 are all focused on lowering the transmission rate, R sub T. So not necessarily targeting the number of interactions, but when interactions do happen, that there's less likely to have a transmission. First and foremost, you've heard it before, you'll hear it again. Ladies and gentlemen, wear a mask, right? And I do cite in my references multiple studies that have talked about the efficacy of wearing masks. You're right, it doesn't stop aerosols from staying airborne. They're not a perfect barrier, but they do a non-zero amount of difference. And there are studies that try to quantify that and have shown that that's pretty significant. Distance also matters, especially when wearing a mask. If you're wearing a mask, staying 6 feet away from others makes a significant difference. But there are more studies that talk about, there's still risk even at 6 feet, and then there's, the risk drops off. So this is what I was talking about, like a typical interaction, whether or not you're wearing a mask, or all factors 7 through 13 affect what interaction risk is associated with that. So keeping 6 feet away from others, don't share items, especially items that make contact with mucous membranes, like food, drinks, utensils, smoking implements, etc. Like this is like, if it was like an infectious person and a contagious person exchanging like a cigarette or a drink or food, it's like you have a very extremely high probability of transmitting, right? Because we know the virus and active viruses are shed through mucous membranes. Disinfecting surface frequently. We know this is not quite as big as aerosol and airborne transmission, but it's still possible. So not touching others, including handshakes, not sharing items you've touched, and following guidelines for effective hand washing. I should have put on here touching the face also. That's really hard for me and for most people. Most people instinctively touch their face pretty regularly. So all of these are meant to make sure your hands are clean and surfaces that make contact with your mucous membranes are clean. As far as we know, the virus can't get in through skin and stuff like that. It's just when it's on surfaces that then subsequently make contact with your mucous membranes. And we know the virus can stay on active and viable for several days on most surfaces after someone were to sneeze or just breathe in an area and the virus were to settle. Not as major contributor as airborne transmission, we think, right? But still factors that can help lower the rate of transmission and therefore lower R naught, and therefore lower the outcome for the public and how many people will get infected and how quickly people get infected. I really should emphasize more. So this the quickness for dealing with when people are sick, but then also the total number of people actually is lower, right? This is actually there's hundreds of thousands of people's difference just between 1.5 and 2.5, right? It's a huge difference. So even if my parameters here were off a little bit on the growth rate, these asymptotic behaviors are ballpark accurate. It's like it's twice as risky, right? You can make a huge difference even if it's not perfect. Just taking basic precautions and doing your best to limit it. A lot of times people, there's a huge difference. We talk about, all the people that are lost and have, died to this disease, but also there's a lot of people that have been saved and can be saved by taking precautions. So 14 through 16 have to do with, they're a little bit more robust in their analysis. So 14, I want to talk about them specifically individually. So the quarantine procedures and policies, this is because if you feel sick or you've had contact with COVID-19 I say COVID-19 person, but someone who is infectious or has been confirmed to have COVID-19, or a person suspected to have COVID-19 positive, even if they don't have a confirmed test. Quarantining until you can confirm that you are not sick makes a huge difference, because the likelihood of transmission is significant enough that it's very possible that you also are sick. I mean, the CDC has said here if it's 15 minutes or more, right? Because at that point they're saying it's very likely or significantly likely that they've transmitted the disease if you've been talking to them, even with like masks on and stuff like that. So in some cases you might be fine, but in many cases you might not. And because you don't know, that's why it's important to isolate, because on average, what this will do is this virtually lowers the contagious portion of the public, right? By putting them into quarantine before they would even start to become, spreading the virus. And this lowers the replication number. Just because if you didn't have this policy and you were exposed to someone and said, I don't need to worry about it. Well, in some cases you might be right, but in some cases you might be wrong. And on average, it'll be a mix of both. And so if everyone's just like, I'm going to quarantine and be safe and get tested, then the people that actually were sick and did contract COVID-19 from that interaction, they can and have a reason to believe they might have a good risk that they have contracted COVID-19, then they can isolate. And that makes a big difference. The other one is 15 is travel and quarantine restrictions to and from areas of higher infection rates. You go to an area where the portion of the population is much higher, to have a higher rate of infection, then that's a problem, because then you're a much higher risk than you would have if you had just stayed in your current location. And so you're importing that risk from that other region back to where you're from, unless you've had gone through quarantine and testing procedures. So following those procedures, those quarantine procedures and travel restrictions, makes a huge difference. Not to mention also, there's another aspect of it, which is, in general, if a public health official is trying to say, all right, we need to limit social interactions, they can't really do that or regulate that locally, but they do have the authority to regulate travel across state boundaries. And so it's a tool they can use. If things get really bad, they can implement that and say, look, we need to, and it could be a soft or a hard restriction. In Massachusetts, it's $500 a day for violating this. But if any interaction is risky, so even if it's the same level of portion of the population that's infected where you're going and then coming back to, not going at all is still staying inside your house is better, right? So people would want to travel for social interactions, and so if you can restrict that, it makes a little bit of a difference, right? But the biggest is if you go to an area, and it's just a blunt tool to make a marginal difference that some policy makers might make because they have the authority to, and it can make a difference if they have reason to suspect it'll make a difference. Certainly in the case of going to areas of higher infection. So that's why, and I'll talk about this later, but when I talk about resources, back here, remember I talked about Johns Hopkins actually had case data by county. Checking that before traveling to a region might help inform you whether you want to go or not, or how strict you need to be in your travel precautions. If you go to if you want to make sure you have enough gas and food, so you don't have to stop in those areas, it can make a huge difference. Right. So back down to where we were. So this lowers the number of interactions, lowers contagious portion of the public, because if you come back and you've imported that risk, that higher portion of the population that's sick, you're a lot more likely to be sick, and therefore, if a lot of people are doing that, the population then that's infectious in your region, your home region that you came from, does go up. So, and this together aggregately creates the R naught to lower, because it lowers the contagious portion of the population that's being imported from other regions, and lowers the number of interactions. So these two, lowers the contagious portion of the population IP and lowers R naught, are slightly disjointed, but they're related, and they're not traveling impacts both of them. Right. So asymptomatic testing. The second one, lowers contagious portion of the population, is more of like an acute, you're trying to mitigate acute risk to individuals, and then the acute risk that'll follow in the weeks after they return, before it gets dampened out, even if everyone else is taking precautions. Asymptomatic testing, this is a huge one, because not having tests, a family member once asked me, like, well, why does it matter if I'm getting tested? I'm either sick or I'm not. Well, that's the problem, is like a lot of people don't know if they're infectious because they won't develop symptoms. And even if you do develop symptoms, you're contagious before that. So having a testing program where people are regularly getting tested before they even show symptoms makes a huge difference. It virtually lowers the asymptomatic portion of the population T. That's supposed to be S. It's a typo. My table referred to it as S, the symptomatic portion of the population. It lowers that so that if you were asymptomatic, your symptom now is the positive test. If that's being done like once a week, right? So there'll still be periods where you could be spreading the virus, but suddenly all those days that you would have been spreading the virus if you're infectious now are gone, right? And so it helps protect the public. And it virtually lowers the days contagious prior to symptoms end, right? So the odds are lower, but there's a chance that you could get the test as soon as you become symptomatic, before we even, right on the cusp of you becoming contagious, which is several days before, potentially, on average. But on average, is several days before you become symptomatic, for those that will become symptomatic, and you can then start to isolate before you spend all 2 days, sharing the virus with the public, or potentially risking the public. And I do want to clarify, I'm like, oh, well, everyone can take some risks. No, it's a risk that's significant enough that you would expect the virus to continue to grow if you don't take a precaution like this one. It virtually lowers the days contagious prior to symptoms end, right? Because if you're someone that's going to show, got it. Virtually lowers contagious portion of public, right? Because both of these groups that would have been contagious in the public that I modeled, right up here, way back at the beginning, right here, the contagious portion of the population, this gets removed because the time being exposed goes down. It removes the N, or it's a portion of N, and it removes the period where a person's recovering that's asymptomatic. They detect the virus and isolate before that period would have been gone, and so the total number of the portion of the population actually decreases because they can isolate because they've been tested. And then altogether, these effects lower R naught, right? So if it's a way of knowing that people are sick sooner, so you can get them out, and so of the public, so the period where they would have been infecting people, it drops off, and so that doesn't exist anymore, and so then you have your replication number drops, and therefore it damps out the growth of the virus, and hundreds of thousands of people wouldn't get sick if this is sufficient. Which corresponds to thousands of deaths from that. All right, so again, all those effects are all about shifting R naught. In some cases, and they do affect the mean generational interval a little bit too, but they all reduce R naught, and like I was talking about before, it shifts from these higher curves with more infected individuals and faster rates of infection to lower numbers of total infections and lower rates of infection. Right, 1.5 is still pretty serious, but if you can dampen it below 1, it goes out to this linear growth that is pretty darn safe for the public, and it spares a lot of people. So that's why all those policies exist, and I just want to talk about how they related back to the models and our projections about what would actually happen. And this isn't just theory, like this is pretty well empirically confirmed and understood, and accepted models or variations of these models. So I'm doing a simple version, but more robust versions are just variations on this. So that's it for this video. I do want to, in my next video, talk about simple steps and tools to adapt. So I want to talk about testing, travel, quarantining, socializing, general precautions, and accessing information as you move forward and until we get through this pandemic. So be well. And I will see you all in my third video shortly.